everyone. Today's video is about a not so delightful topic, warts. Now, warts are very common. They are caused by viruses, typically in areas where the skin has been broken down for some reason. Think about your skin as this armor over your entire body. And if there's one area that's been rubbed or is raw, it makes it easier for all kinds of germs, bacteria and viruses, to get into the system. So if you have a tiny little splinter sometimes on the bottom of your foot, we see this a lot later because the skin was broken, that very same spot can grow a wart. So I'm just going to talk to you briefly about some quick and easy ways to get rid of the warts. Basically, they're just a big pile up of dead skin cells and extra keratin. They can be very painful in certain areas though, particularly on the bottom of the foot, because it feels like you're stepping on a pebble or a rock in your shoe every time because it's that little hard area. So everything we do to get rid of warts just has to do with tissue destruction. We're trying to destroy that area. So the ultimate would be a surgical removal, but that's not usually necessary. We can try to give them frostbite or freeze them in the office with liquid nitrogen, and that's the same thing that dermatologists can do, or they could surgically remove them as well. Of course, with numbing medicine, don't worry. Now, we don't use numbing medicine for the liquid nitrogen because it really just is a very, very cold sensation. And the problem is, though, if it's a very thick wart, particularly plantar warts, are so thick it's hard for that freezing to get all the way down to it and actually kill it, especially in one treatment. It would take multiple treatments, and sometimes that can be expensive for the families. So I want to tell you what I recommend instead. Now, also remember, if this wart is small, it's not infected or red or draining or oozing, and if it's not painful, if it's not bothering the child, they're not embarrassed by it, or it's not causing social problems, it is perfectly acceptable medically to ignore it, okay? But we're talking about ones that for some reason the child is embarrassed about, or it's painful and they just want to get rid of them, okay? One of the most common places is plantar warts, the ones on the bottom of the foot, because we're more motivated to kill them because they're causing pain when you walk. So here's what I'd recommend. First, you want to soften the area. So for feet, especially on younger kids, you could just do this after they took their bath or shower, and that tissue, that flesh is nice and soft. Then you can scrub off all the excess dead tissue on the very top. You could do that with a nail file or a pumice stone. Remember though, since this is caused by a virus, you would never want to share that nail file or pumice stone with somebody else, because you could share and spread that virus to them, and then they could have warts wherever they had used that instrument. So soften by a bath or shower, scrub off the dead part, and then this method is using acid. I want you to go out and purchase Dr. Scholl's Plantar Wart Remover Discs. So these little discs are little brown sticky circles. They are saturated with salicylic acid. In fact, they're 40%, which is even higher than the compound W that you can buy. And this is all over-the-counter stuff. So you soak it, you scrub it, you put this little sticky disc of acid on there. Now, the box will come with circle band-aids that fit over it, but those are really easy to, especially on the bottom of your foot, to sweat off or to rub off. So a lot of times you are going to need to use some duct tape just to secure this in place. And all the directions will be on the box, but basically you repeat that little process every 48 hours or every other night. You keep using it until the entire visible portion of the wart is completely gone. It's flat with the normal skin, and then maybe one more night just to be on the safe side. I know with one of my kids, I stopped when it looked almost smooth, and then it grew right back. So you really want to make sure you get rid of the entire thing. And I'm telling you this also because some parents will come into the office just for us to look at the wart. If you're sure that it's a wart, I give you permission to trust yourself. It probably is a wart, and it's okay to attempt to use the Dr. Scholl Plantar Wart Disc first before you come in, because it's often expensive for us to use the wart freezing in the office. We don't mind, and we have a neat little machine to do it, but it can be a higher deductible or copay for the parents for us to do that because it counts as a procedure. So I hope this was helpful. Mainly, I want you to remember that you shouldn't panic or freak out. Warts are relatively common, and it's perfectly okay to ignore them if you need to. The other thing that can be confused with a wart, and it's sort of a distant relative, is a rash called Molluscum Contagiosum. That's when there are usually multiple, and they are flesh-colored papules, meaning they're the color of the skin, and they're raised, sort of dome-shaped, almost like a pearl, but there's a tiny little indentation right in the very center of them. That's called umbilicated, like a little tiny belly button. So if you have a little crop of flesh-colored raised pearl-looking lesions with a tiny dot in the center, that's probably Molluscum contagiosum. They are contagious to other kids, but most people only have them once in their lifetime, and you do not have to treat those because there are too many to treat for one thing. The main thing for you to remember is that they're harmless and that they can last 1 up to even 2 years, but it's perfectly okay to ignore them as well. And often when the body's immune system is fighting them off, they'll get sort of red and inflamed right before they go away completely. So I hope that's been helpful about warts and Molluscum contagiosum. Thanks.